Hello everyone, myself Dr. Anukalp Prakash. I'm a senior consultant gastroenterology. Today I'm going to talk about a very common clinical problem, the acid reflux. Acid reflux is medically known as gastroesophageal reflux disease, that is GERD. So GERD is defined as the reflux of gastric content into the food pipe. Normally, acid is produced in the stomach and it should remain in the stomach. Whenever the acid which is produced in the stomach will come up in the esophagus, will give troublesome symptoms to the patient. And these symptoms can be heartburn, regurgitation of the food, excessive belching, excessive salivation, nausea, vomiting. These are the typical symptoms of the reflux disease. There are certain atypical symptoms the patient can have because of reflux. These can be non-allergic asthma, dental caries, chronic cough, ear problems, hoarseness of voice. So if the patient has these kind of symptoms, probably he or she is having reflux disease. So what are the symptoms? After the symptoms, what are the risk factors for the reflux disease? So this is a lifestyle disease. Because of the faulty lifestyle, there is a valve between the food pipe and the stomach which gets loosened up. Because of the loosening of this valve, the gastric contents start coming in the food pipe. Those patients who are obese, those patients who consume lots of alcohol, are smokers and take fatty food, who are stressed, are more prone to develop these kind of diseases. And those who have sedentary lifestyle, do not do any physical activity, will develop reflux symptoms. So if we talk about the treatment of the GERD, the treatment surrounds the lifestyle modification. The lifestyle modification is the most common way to get rid of the reflux symptoms. What are the lifestyle modification which one has to follow if he or she is having reflux symptom? He must eat small in quantity and frequently. He must include 30 to 45 minutes walk or physical activity in his or her lifestyle. He should avoid fatty meals. Smoking, alcohol must be curtailed in the diet or the lifestyle. He must take 6 to 8 hours of proper sleep. Stress must be curtailed in the lifestyle. Fatty food definitely aggravates the reflux symptoms, so should be avoided. The dinner should be early and it should be the lightest meal of the day. We should not give long gaps between the meals. We should not drink water immediately after taking major meals. We should give at least 1 hour of gap between the meal and the water intake. We should not lie down immediately after taking dinner. There should be a gap of at least 2 hours between the meal and the time to sleep. As far as the medicines are concerned, there are certain medicines which would help to reduce your reflux symptoms. These are very simple and commonly available and prescribed drugs. These include ranitidine, pantoprazole, rabiprazole, omeprazole, esomeprazole, ilaprazole. These are very safe drugs which are easily available and do not have any major side effects. But the first and foremost things is to avoid the faulty lifestyle. We must change our lifestyle to minimize the symptoms of reflux. Unless we change our lifestyle, the symptoms are going to come back once we stop the treatment. So lifestyle modification plays a very, very important role in treating reflux reflux problems. Those who have developed complications because of the liver, because of the reflux disease, require endoscopy for the evaluation of the injury. What are the complications of the reflux disease? Some of the patients who have chronic reflux history might develop narrowing of the food pipe. They may give history of difficulty in the swallowing. Some of the patient might develop bleeding because of the chronic reflux and they develop anemia. Few patients may develop ulcers because of the reflux, and chronic reflux is one of the common cause of cancer of the lower end of the food pipe. So those patients who are not responding to the treatment or has developed anemia or are losing weight must get an upper GI endoscopy to evaluate for these complications. So again I will say, this is not a disease, this is just a lifestyle disorder. We must change our lifestyle to take care of our reflux symptoms. Thank you.